Hello, it's Julie, owner and physical therapist at Lady Bits PT. Today I want to make a video for women suffering with prolapse. This is specific for what do I do? So today's video is going to be the exercises that I would recommend to my patients when it's time to start healing that prolapse. So with everything, if it hurts, you need to stop. And if you're having any pain, you need to see your doctor. None of this should hurt, okay? So see a skilled women's health physical therapist. Always ask your doctor. But other than that, let's get started. So recognizing prolapse is too much downward pressure on the pelvic organs. We're gonna take gravity and use it to our advantage. So we're gonna lay down. And you've heard me mention this before, but I'm just gonna go ahead and get on the floor and show you today. So you can get on the floor, grab some pillows. We're gonna get your hips up. So, however many pillows you can shove under your bum, we're gonna shove under your bum. Alrighty, so, right here's a good place to start. So this feels pretty good already. So find that comfortable spot. Now my pillows kind of let me sag a lot, but the more pillows, the higher your hips are, as long as you're comfortable, is better. You kind of want to build a wedge. Okay, so in this position, just take a moment to breathe and recognize how's the breath moving through your body. Because with pelvic organ prolapse, it's all about too much downward pressure. But where is that pressure coming from? It may have come from a pregnancy. It may have come from having a lot of weight, extra weight on your body, maybe not pregnant, but having weight. It may be because you have a lot of lifting tasks in your day and you're going to lift, which I've talked about in other videos. So we're really going to check in with your breath because it's all about managing the pressures within. So I want you to place a hand on your belly and a hand on your chest and breathe. And notice which hand is moving. Hopefully they're both moving a little bit. Go ahead and put your hands around your lower rib cage and breathe. And as you exhale, just notice the sensations in your body. You might feel a little pulling sensation coming in this way. That's actually a good thing. That's your pelvic organs coming back up where they belong. So if you feel this gentle kind of slide coming up this way, just as you just rest here, that's not a terrible thing. That's actually a good thing. So we want to establish a normal breathing pattern. By normal, I mean diaphragmatic. So I've talked about this in other videos, but let's just touch base again. Diaphragmatic breathing means you're breathing into the sides and the backs of your rib cage. It's not all upper chest. It's not all belly. So we're going to go into the sides of our rib cage. So just kind of put your hands on your rib cage. Inhale. Hopefully you're feeling your ribs expand, and exhale. And hopefully you're feeling them just gently draw back in. And now I want you to pay attention to this sensation right between your pubic bone and your belly button, real low. Inhale into your rib cage. And exhale. Let the ribs kind of just gently come back together. You may notice with every exhale that you feel just a gentle little pulling sensation down here. That's a good thing. So we're going to take advantage of our breath. We're going to use our breath to help bring the pelvic organs back in. So when you exhale, I don't want you exhaling with too much effort. I don't want you pursing your lips and creating resistance around your lips. I want it to be an effortless exhale. You're not, your face is soft. You're not limiting your exhale. I find a lot of women, when they shift into exercise mode, think that they have to and really blow through pursed lips, but that's not it at all. I don't want any resistance. I don't want any added pressure down here. So it's just an effortless blow. Maybe a blow as though you're blowing on a dandelion or blowing out birthday candles very gently. And now when you add that extra intention of I'm blowing on a dandelion or I'm blowing on birthday candles, you might notice with your hand down here, you might feel a little gentle muscle kick in under your hand. So let's try that together. Inhale and gently blow on the dandelion. There, I just felt my muscle kick in right there. It's going to be really subtle. It's not a clench. It's not a grip. You're not purposely turning on your abdominal muscles. They just naturally turn on when you blow with that kind of intention. So inhale and blow on the dandelion. You should feel this gentle kind of, I don't even want to call it a tug or a pull, but a sensation. You should just feel this gentle sensation. Maybe you feel a little muscle turn on down here. So that's a good thing. What I don't want to have happen is I don't want you to blow and have a bulge down here. So a lot of women who I work with, they don't breathe correctly. And when I go through this breathing technique, they go, and their belly is actually pooched this way. You can see it. That's not good. That's not what we want. So you saw it was gentle. It wasn't much. You may feel your belly button go slightly in, and by slightly I mean 1/4 of an inch, slightly in and ever so gently up, barely, up towards your heart. And that's when you're doing it correctly. If your belly button is bulging out or moving down, that's not what we want. So be mindful of your belly button and feel your lower belly, and make sure what you feel is everything kind of sinking in and coming up. So inhale into those ribs and exhale. Oh, doesn't that feel nice? So now that you have the breath, now we can really use that to lift those pelvic organs back up, because that's essentially how you're going to do this. You're going to use your breath, and you're going to use the deep transverse, the deep abdominal muscles, which attach to the lifters in your pelvic floor to get that lift. Because we talk about the Kegel as a squeeze and a lift, but the lifters, they really kick in when you are gently breathing correctly. So let's kind of just gently pull it all together. So when we inhale, we relax, we do nothing, we just appreciate our ribs spreading out to the side. And now we exhale with enough effort to blow on a dandelion. You feel everything kind of come back together. You can imagine 2 dots on your hip bones, and as you blow out, those dots gently come together and slightly meet up towards your belly button. They're not really going to travel that far, just imagine. So as you blow out, feel those 2 dots moving closer together and slightly up. And now you're doing it correctly. Now the other part to consider is, yes, we want to bring the pelvic organs up, but we also want to stop the loss of pressure down there. So pelvic organ prolapse is too much downward pressure. So let's plug the hole. Let's stop the loss of pressure down there. So we're going to add a little Kegel, a little pelvic floor contraction with this. So inhale, let those ribs expand. And now exhale and squeeze your pelvic floor with that. So blow and squeeze. So you are squeezing. So you're thinking, don't pee in the pool, don't fart at the party. That gets your squeezers going. So inhale, exhale, blow and squeeze. And you may notice when you squeeze your pelvic floor that you feel these little deep abdominal muscles. They kick on even a little bit stronger, not because you're trying, but because your body's built to have that all work together. It may take a while to feel that kick on, especially if you just had a baby, but trust in your body, it will get there. So let's do some of those together. Let's do 5 of those together. Inhale, blow and squeeze. And feel that gentle coming together and moving up. Inhale, relax everything. Blow and squeeze. Inhale, relax. Blow and squeeze. Now see, I just made my own mistake. I was blowing through pursed lips just to demonstrate the blow, but I don't want you pursing your lips. So don't have an audible blow like I was doing. I was doing that for demonstration purposes. So inhale, relax. Blow and squeeze. Inhale, relax. Blow and squeeze.
For some of my patients, I have to have them pretend that they're holding a cotton ball on the surface of their hand and they're blowing the cotton ball across their hand. So not too much effort. You don't want to feel a bulge down here. So once you feel comfortable with that, and you feel like, okay, I've got this. I can blow. I can feel this gentle, tiny contraction. I feel like a little something slipping up. Now you're doing it really, really well. You add that squeeze and everything comes together. So if I was taking care of you and you had pelvic organ prolapse, I would say, please get in this position 3 times a day. Get some pillows under your hips and just practice gentle breathing, gentle blowing, and throw that little squeeze on at the end of the blow. The most important thing is please, please, please turn your muscles off when you inhale. You can't keep contracting if you don't relax. So you're just wasting your time. So when we inhale, we let everything go. The vagina opens, the rectum opens, you let it all go. Inhale and blow and squeeze. I guess you do have to purse your lips a little to blow out a candle. So just a little, but make sure you're not bulging down here. Now if we want to add a little bit extra intention with the squeeze, you can grab a pillow, or I've got a little ball. You put a ball between your knees or a pillow. I'm not picky which one. And now when you squeeze that ball together just a little bit. It's going to help your pelvic floor contraction turn on a little bit more. You're going to feel like you can get a little bit better Kegel. So inhale and blow and squeeze. Ah, it just feels so nice. Inhale and blow and squeeze. So this should reverse a lot of the symptoms of heaviness. If you feel like you get really heavy, this is why I say do this 3 times a day. We're essentially pulling our organs up 3 times a day. We're using gravity to our advantage. Inhale, relax. Exhale, squeeze. And when you get bored of these and you're like, oh my gosh, I've had enough of those, I want something more to do, it all depends on where you are. If you've just had a baby, this is all you need to be doing. If your babies were years ago, maybe you're ready to do a little bit more. So I really want you to listen to your body. If you feel like, I can do a little bit more and I've got this and this is easy, here's how you can then integrate that kind of into the next step, is you can build a bridge into that. So you inhale and blow, bridge and Kegel. So it takes a little bit more coordination. So I am doing a Kegel, I am gently squeezing the ball, and I am blowing. So you can try 10 of those. And then when you get sick of doing those after about 10 or so, you can try another version. This one's a little bit trickier. It's this butterfly bridge, and I absolutely love it. You inhale first, and then you blow as you lift, bringing your knees together, bringing your hips up, and yes, of course, squeezing the pelvic floor. Inhale and relax all those muscles on the way down. Turn the pelvic floor off. Exhale, lift and squeeze. So yes, these are more challenging the more that I'm showing. We'll do 10 of these together, that's 2. Three. I'm blowing extra loud for demonstration purposes. 4. Feel that come in. If I'm making this look easy, it's because I do it all the time when I demonstrate, so understand it takes a little while to get the hang of this for some women. So I just lost track of how many I'm doing because I'm really not counting. I'm really just listening and feeling my breath. Hopefully I've done close to 10. You're going to feel this in your hips because when you come out, you're controlling it. You're going slow. When you come up, All your hips and glutes are working, so you're going to feel this everywhere. Now let's take those pillows, put them back under your bum. However many pillows you're comfortable shoving under there. For some women, it's just one. For others, it's two. It really all depends on how strong are your glutes. How far can you get your butt up in the air to shove a pillow underneath you? Okay, and then we're just going to rest. Just rest like this. Your legs going to flop out and they can be out in front of you. So let's talk about a game plan. If this is something that you're suffering with, why not try this 3 times a day? You can just try the exercises that work best for you. It might just be the breathing with your hips up. Please add that Kegel in. If you're not ready for the butterfly bridge or the bridge with Kegel, that's okay. Build up to it. But try, 2 or 3 times a day. Get your hips up. Try 10 breathing, just the breathing. I would try 10 of those, just breaths. Maybe 10, follow with 10 breaths with the Kegel. And if you feel like you can throw in 10 little bridges or 10 butterfly bridges, just try 10. And then when you're done, just rest in this position for a couple minutes, 5 minutes if you can, just to allow those pelvic organs to come back up. Now, if you're a busy mom, you're going to say, oh my God, I don't have time to do this 3 times a day. And you're right. You're just going to do the best you can. If you've got a job, you're going to say, oh my God, I can't do this 3 times a day. You're right. You're going to do the best you can. So try to fit it in the morning, squeeze one in when you can somewhere in the middle of the day, squeeze one in the evening. Keep in mind that when you're sitting, your pelvic organs are still, the gravity is still bringing them down. So if you're Netflix and chilling in the evening, Netflix and chill with your butt up for a few minutes. Take advantage of that time and breathe things this way. Obviously, if you've just eaten, this is not an ideal position for digestion. You want to give yourself time to digest what you've eaten. But try this. If you have any pain or discomfort, please discontinue and see your healthcare professional. Feel free to email me, julie@ladybitspt.com. You can like, subscribe, and share. Give this a whirl. Try it 3 times a day. See how different you can feel as things will come back up and your body is made to heal. Your collagen is remodeling all the time. It takes a couple months for collagen to remodel. So even though you might get started on this and you might feel great after a couple weeks and you're like, oh my gosh, I'm healed, I'm better. And then you jump back into something you were doing before because you think you're better. Just because you don't feel the symptoms doesn't mean you're better. So always listen to your body, listen to your symptoms, and recognize I may not feel the symptoms, but it doesn't mean it's not happening. Let me keep doing this for another couple months and really let that collagen completely remodel. So you might feel great after a month and want to get right back into everything you were doing before, but I say give this 2 or 3 months. Really give your body time to bring everything up, let that collagen remodel, pay attention to all the other videos I made about blowing and breathing and exhaling with effort and not getting constipated and not straining on the toilet, and I will see you soon. Take care, and this is safe if you've had a baby and you're postnatal, this is still safe, okay? Take care, and I will see you soon. Don't get up like that, by the way. That was not very good.